Hi, I'm Dr. Hussein Abbas, a general and bariatric surgeon here at Memorial Hospital. So what we've decided to do is, by popular demand, is to have a live Q&A sessions. We're going to have a lot more of these, so this is just the first one to start it off with. And the goal here is I'm going to be here with Jenny, and I'm going to be here also with Cynthia. So they're our bariatrician and, of course, our bariatric coordinators. And the goal is to try and answer questions that are fairly frequently asked or brought up by our patients. So I have Jenny here who already have received some questions, and we're going to kind of start through there. And then if you have any questions, you can post them, and she will basically relay them to me.
Awesome. Well, very good. So first off, just talking about bariatric surgery, who is a candidate for bariatric surgery?
So that's obviously a very frequent question that people ask is, who is a candidate for bariatric surgery? Generally speaking, is anybody that has a BMI greater than 35, and the way you calculate your BMI is everybody has a smartphone now. Just type in your height and type in your weight in a BMI calculator, and you'll actually get your BMI. So BMI greater than 35 with a medical condition such as diabetes, hyperlipidemia, which is elevated cholesterol, or hypertension. Or if somebody has a BMI of 40. So again, if you just type in BMI calculator in your Google search, you'll actually find it. And the way the BMI works is actually your weight relative to your height. So that's what the BMI stands for. And it stands for body mass index. So those are the patients who are actually are candidates for bariatric surgery.
All right. And then another question, are there, if there are any risks, what are the risks of bariatric surgery?
So generally the risks of bariatric surgery, we kind of can separate them into two. The short or intermediate, which we call, from a surgical standpoint, technical problems. So for example, if anytime we staple or suture any organ, there is a very small risk of actually the sutures kind of opening up. And so that is called a leak, which is what a lot of people have heard of. Well, what are the chances of having a leak? Having a leak is extremely low, and the quoted number is probably around less than 1 in 1,000. And that's probably around what our rate is here as well. It is extremely low. It tends to be more likely in revisional surgery, so when we're doing even more complicated surgeries, as in somebody already had a bariatric surgery and they're lost weight and they plateaued and they want to lose some more weight. So we revise these surgeries. So those are patients that actually have a little bit of higher risk of having a what's called a leak risk. There's also a risk of bleeding. Again, we never leave the OR knowing that there is any bleeding there. Vast majority of bleeding just stops on its own and what's called self-limited, and nothing really needs to be done with that. And this is obviously anytime you cut any tissue, or it's like having a bruised muscle. So you can have a little bit of bleeding there. But again, we make sure that while in the operating room, we take care of all bleeding. Infection is always a risk, but we do give patients antibiotics. And the other thing that we do nowadays is making very small incisions. Most incisions are the size of my little finger, the tip of my little finger actually, and so this really decreases the chance of having wound complications or infections. So all these measures are taken to really decrease the chance of having any, to lower the risk of having complications. The other one that we usually talk about is the long-term effect. And the long-term effect is predominantly due to non-compliance, for example. And the one main reason is not taking multivitamins, or reverting to old habits, eating refined sugars, and essentially having a bad dietary habits, which probably led the patient to the to being obese in the first place. So those are the two risks. There are more risks, of course, that we describe, and we will going to be posting them down on our Facebook page if you are interested in more specific answers for your questions.
And then with the coronavirus going on.
Correct.
Some people may be nervous about having a surgery right now. Is there a higher risk of getting the coronavirus or contracting the coronavirus with having the surgery during this time?
So this is a very good question, and we've had this question being raised multiple times. Let me actually kind of put this whole thing in perspective. we've actually gone beyond, what has been recommended by the CDC, by the Department of Health, to make sure that our patients are safe, because that's our number one priority. The patients are safe, and at the same time, the OR staff is safe, because we do not want to have someone, for example, who's asymptomatic inadvertently infecting, our OR staff, because this is fairly serious, because they obviously take care of our patients, and we have to protect them as well. So what have we decided to do? We essentially test everybody. So everyone will get tested to make sure they do not have the virus before we even decide to move forward with surgery. The second thing is we've done is we've really limited the number of people who actually are coming into the hospital, especially visitors. And the reason for that is we're really trying to make sure that we have a good control. Until we get a better control of the virus, we have a good control of who comes into the hospital and who is in contact, with patients. You're seeing me here without a mask, but that's because I'm actually fairly far from Jenny, who's on the other side of the camera here. And otherwise, every person, not just physician, every person who walks into the hospital must wear a mask to try and decrease the risk of transmitting this to someone else inadvertently. So those are actually the steps that we've taken to make sure that we are safe. The other thing that we have found during this pandemic is very unfortunate, is that we have actually found that most people who had either required intubation or ventilation, so required a respirator, were either obese, had diabetes, had hypertension, or had other medical comorbidities. And unfortunately, this does tend to affect sometimes some minorities, because they've not been able to get access to health care. And specifically addressing obesity as an overall disease, because obesity is a bigger problem than just a one simple thing. I wish it was as simple as eat less and exercise and you will lose all this excess weight. That is a very important part of it, but that's not the only part of it. The other very interesting thing that we found is that patients who actually had metabolic surgery, and this had led actually to laws being changed in the United Kingdom because they were restricting how many patients were getting this surgery, did a lot better in this pandemic. If they were infected with the coronavirus, the so-called COVID-19, they actually did a lot better. So their survival was better. The requirement for intubation and ventilation was better. Again, what this tells us is that metabolic surgery addresses a whole bunch of systems. It helps improve your respiratory system, cardiovascular system, on top of that, of course, nutrition. So all in all, it actually addresses a lot of issues. And that's a very good question. And this actually has made us, or reinforced what we know, that when you have metabolic surgery, it helps you overall and not just one specific system.
Very good. And then on another topic of another condition, will bariatric surgery help with diabetes?
Absolutely. In fact, what we have found nowadays is the American Society of Diabetic Physicians, actually, what they have done is they have recommended that perhaps when somebody has diabetes, we should be operating at a much lower BMI, because we've noticed that when your BMI is around 30 or 32, you actually will benefit more from metabolic surgery, because the whole goal of metabolic surgery is to reverse and protect you. This is one of the very few surgical procedures we perform to actually prevent problems in the future. So it makes no sense to wait for the diabetes to lead to obesity and then have to try and reverse it, because then it becomes a lot harder to reverse that. The goal is really, and at least our ultimate goal, is to make sure that we get patients at a younger age before they have developed any of the complications of diabetes, because this can limit it. And absolutely, the certain bariatric procedures or metabolic procedures that have almost a 90% cure rate for diabetes. There is no other medication that can do that. Medications only control your sugars, whereas this surgery actually cures it, which basically means it will make you diabetes free. the least it will do, it will control the sugars significantly better. And you will need a lot less insulin or a lot less of your medication that you're using before surgery.
Okay. How often do you see people regain large amounts of weight after bariatric surgery?
Again, very good question, because one of the things that we hear constantly is, well, I know my sister, or I know my friend, or I know someone else, for example, who had bariatric surgery and then they gained all their weight back. So this is not unusual. It can happen. The proportion of patients who regain their weight, it really is variable, and it predominantly depends on how many or what kind of procedure actually they had, and how obese they were, or what was their BMI before the surgery. So, and the reason why people gain weight, it's actually because of poor dietary habits and also lack of follow-up. I tell all my patients, if you notice that you're starting to gain weight for whatever reason, then come back and see us. Come back and see us. We have a lot of tricks up our sleeves that we can help you with to try and at least curb your weight gain and try and reverse it actually for you. So weight regain is a possibility. A little bit of weight regain is normal. So if you lose 100 pounds after your bariatric surgery and you gain 10 pounds back, that is normal. But you should not be gaining back 70, 80, or 90 pounds. That is abnormal. And generally, people gain that weight because they tend to consume what I call empty calories. What that means is candy, sugary drinks, sweet tea, Coke, pops, whatever is your soda, your favorite soda. Those have a lot of calories and they're liquid. So basically, while your stomach might be a lot smaller right now, it doesn't even get filled with that calories. So it just passes through you. So that's why you're consuming all these calories, but you're not feeling full. So you continue on eating or continue on snacking on these refined sugars.
And it doesn't look like we have any questions from viewers. So one question I know that's commonly asked is, how do I know if my insurance covers the
That's
surgery?
a very, very, very good, again, another very good question is, how do I know if my insurance covers it? What I'm going to do is I'm going to put actually a link connected to this post, so you can just click on it so you know exactly what is required. So here at Memorial, what we do is we essentially have what's called all these accreditations. So we are a center of excellence. And the other thing is that because of the outcomes, because of of our low readmission rate, very low complication rate, very good outcomes, we essentially are part of every insurance that is out there. If your insurance covers bariatric surgery, and they all will tell you if it's medically necessary, and we will actually tell you to call our office with the information and the policy number, and then we will check for you if your insurance covers it or not. Unfortunately, there's so many different insurances out there nowadays that we actually have to specifically find out if your employer, which is where most of our patients get their insurances from, chose or elected to have bariatric surgery as one of the coverages or not. But it's very simple. Click down on the link, and we will actually explain all that to you, and we'll have one of our office staff call you, and essentially our bariatric coordinator, to try and discuss with you if your insurance covers it or not. And if it doesn't cover it, well, what are the other options? Again, there are a lot of other options that we can do that. Remember, our goal is to help you. We strongly believe that this is significantly, actually, let me put it another way. If you do the maths, we are providing this surgery to only less than 1%. That's 1% of the people who really need it. To me, that is outrageous, and we must do a better job, because if this pandemic showed us anything, it showed us that people who are vulnerable need to get help. Until next time, we'll see you again. I'm Dr. Hussein Abbas, a general bariatric surgeon here at Memorial Hospital. Thank you, Jenny.